شكرا للدكتور سعيد ونشكر الشركة على دعوتنا وعلى المجهود اللي هي عاملاه في السوق المصري، واحنا الحقيقة محتاجين لشركات مصرية 100% علشان تنافس شوية الشركات الأجنبية اللي هي موجودة. النهارده هنتكلم على نيو جروب اوف دراجز اللي هو رانديل بوتاسيوم شانل اوبنر.
شكرا دكتور عزيز، وبداية بحب أشكر شركة أدوية لإتاحة الفرصة إن احنا نلتقي النهارده. So let's see the new anti-anginal drug should reduce ischemia, relieve symptoms, and improve prognosis. Let's see how Nicorandil does these three main actions. Nicorandil is a nicotinamide ester having a nitrate group and having a double mode of action. It acts as a potassium channel opener, and it also has a nitrate-like action. These potassium channels are voltage-gated and ligand-gated, and they activate the ATPase in the sarcolemmal membrane and the mitochondrial membrane. They also are sensitive to the acetylcholine. These activation of some forms of G proteins on the cell membrane, like the adenosine A1 or the opioid alpha-1 membrane, will produce shortening of phase 3 repolarization of the action potential, increasing the hyperpolarizations of the cell membrane, decreasing the calcium entrance, and preserving the ATPase inside the cell. This also occurs on the surface of the mitochondria with membrane depolarization, swelling of the matrix, and therefore enhancing the respiration of the mitochondria and reducing the calcium overload. These agonists of the mitochondrial as well as the sarcolemmal potassium channels act selectively on these membranes, and among the top of the list is the Nicorandil. By opening these potassium and allowing the calcium channels to reduce its content into the cells, thus the effect of the Nicorandil on the blood vessels is actually dilatation. Through opening of these potassium channels, it produces dilatation of the arterioles, reducing the coronary resistance and therefore increasing the coronary blood flow. By dilating the large vessels, veins, and epicardial coronary vessels, it reduces the preload and afterload and increases the coronary blood flow. So Nicorandil acts by two mechanisms on increasing the coronary blood flow. On the myocardium, it has a preconditioning or mimicking an ischemic preconditioning status. The potassium channels on the membranes of the sarcolemma or on the mitochondria are important components or and effector in the process of preconditioning. Initially, it was emphasized that the sarcolemma potassium ATPase channel mediated some form of cardioprotection during episodes of ischemia, and evidence is there through the activation also of the potassium channels on the mitochondrial surfaces, producing some form of cardioprotection. So in addition of the mitochondrial opening as well as the sarcolemmal potassium channel opening in the cardiac myocytes, there is some form of pharmacological preconditioning of the myocardium, increasing its resistance against lethal ischemic attacks, and therefore prolonging the myocardial resting phase potentials, improving the respiration of the mitochondrial and energy production, preserving the ATPase inside the cells, and increasing the cytoskeleton tolerance to stresses. By opening the sarcolemmal potassium channels, Nicorandil increases the potassium efflux during repolarization. Hyperpolarization of the cell membrane prolongs the myocardial resting status. So by these two mechanisms of action, there is improvement of the cellular respiration, increasing in the energy production, and tolerance to stress. The cardioprotective effect of Nicorandil is thus emphasizing and mimicking conditioning of the preconditioning ischemia, where single or multiple brief attacks of ischemia have protected the heart against a prolonged ischemic insult, and thus reducing the myocardial damage, which results in prolonged ischemic attacks. During prolonged ischemic attacks, reduction of the infarct size, reduction of the ultrastructural changes, higher ATP reservations inside the mitochondria as well as the myocytes, and therefore fewer arrhythmogenic effects and better functional recovery. So Nicorandil has an anti-ischemic effect by arterial and venous dilatation. It has a cardioprotective effect through the mimicking of the ischemic preconditioning, reducing the angina as well as its outcome. Therefore, combining the hemodynamic and the metabolic benefit of Nicorandil, we can reduce the symptoms, reduce the morbidity as well as the mortality.